everybody. I'm Saleha, and this is Chai Chat and Community. Tonight, we are talking about vaccination and young children. But before I introduce you to Dr. Raj Khillan, who has been on my show for the last few months and has very kindly given his time, I would like to acknowledge the traditional owners of the land on which we are meeting tonight and pay my respects to the elders, past, present, and emerging. Meet my guest, Dr. Raj Khillan, who most of you know. Thank you very much once again, Raj, for ever obliging and for ever agreeing to come to the webcast and talk to the community about very important things, which are very, very important for the parents regarding their babies.
Yeah, it's always my pleasure, Salah. Thank
Thank
you.
you. Um, so most of the questions that I have are from the mothers who have been sending me some of the questions. So I will start with the first one, which has been, do kids get COVID? Especially now because the numbers are rising every day exponentially, and I have been told that August is going to be really, really bad. So yes, will children be affected with this COVID, and do they get it?
I think, Salah, I mean, if we take it in that way, infection does not discriminate between any age. It can happen more than 60, less than 60, 50, in 5-year old, and even 5 days old child also. So this infection does not discriminate based on your age. So any child can be infected at any age. The important thing is not the infection, the important thing is the effect of that infection on the child. And we have seen in the past 2 years of experience from where we have learned a lot across the world, and we've seen that kids been infected, they've been affected, though their severity of infection or the symptoms of infections are very less and less intense as compared to adults, and their possibility of ending up in intensive care in the hospital as compared to adult is definitely less. So that's why the overall mortality rate in children is overall, as mortality means the death rate from the infection across the world, is relatively very less as compared to adult. Important thing is that the chances of infection in children may be sometime may be higher, and they may remain asymptomatic because there is no symptoms which shows that they're infected as adult. Once you're infected, and you have a sort of a croaky throat and coughing and spluttering and having a breathing difficulty, you are likely to isolate yourself. But here, the kids' symptom, the children's symptoms can be very deceptive, as they generally have a very, very mild sniffle, or maybe have a sore throat, or may they ignore it and then keep playing and keep infecting the other member of the family, or in the school, or in the community. So chances of infection is definitely high. Chances of transmission of infection among children or from children to adult is absolutely very high. But luckily, due to some unexplained reason, some of the reason we know because of the immunity, and their severity is very, very less. And I can see the trend we will see with the increasing number of infections now, as I mean everybody must have heard in the news, and that the COVID B45 strain is increasing, and the chances of that we will peak probably in mid-August or end of August, and it's going to be the maximum number of cases, and our hospital is going to be overflown with the number. So infections would be there, and likelihood that some children would get infected during this time too, and they may end up in the hospital. In fact, I'm on call for the John Kerner Children's Hospital today, and today I went for the round, and there were a few COVID positive patients I are admitted under my care in the hospital.
So Raj, is there? You said there is no age. A baby of 6 months can have it. A child of 16 can have it, and I can have it, and you can have it. So there is no age. So a child can have it at any stage of life and at any age. I'm just kind of reiterating. So, because I'm just looking, some people are joining in just now, so I can see them. So I just want to make sure that they know about it. So, this is also the flu season, isn't it, Raj?
Yes,
So,
absolutely.
yes. So, how do you differentiate between whether my child who is, 2 years old has got the flu because they are going to the childcare, or whether they have COVID? What are the symptoms?
I
And
mean,
if you can please say part of this in Hindi or Punjabi, that will be great.
I'll
Thank
try
you.
my best to mix it with the different
Thank you.
languages. So, first thing to understand, what are the common symptoms? कॉमन प्रॉब्लम क्या होती है? कोई जब भी या तो कोविड हो या अ, आपकी फ्लू इन्फेक्शन हुआ, या इवन आप कह लीजिए कि हे फीवर की जो एलर्जी हुई, दोनों तीनों के जो सिम्टम्स है वेरी बहुत मिक्स्ड टाइप के हैं, ओवरलैप करते हैं एक दूसरे के। दो, वन इज टेम्परेचर, ठीक है, या आपको फीवर हुआ। दूसरा हुआ कि फीलिंग वेरी फैटीग, लेथार्जी, वेरी स्लीपी, टायर्ड, कि कुछ काम करने को मन नहीं कर रहा, सिर्फ लेटे रहने को मन कर रहा है, ना खाने को मन कर रहा। तीसरी चीज होती है कि आपका ब्लॉक नोज, कि आपका बिल्कुल नाक बंद है। चौथी चीज है कि सोर थ्रोट, एब्सोल्युटली क्रोकी वॉइस। पांचवी चीज है कि आपकी ब्लॉक नोज तो है बट साथ में रनी नोज है, कि आपको बार बार ब्लो करना पड़ता है। देन आपकी बात आती है स्नीजिंग, बहुत सारी छींके मारना, अगेन एंड अगेन एंड अगेन एंड अगेन। उसके अलावा होती है आपकी टेम्परेचर कितना ऊपर नीचे जा रहा है। फिर आती है कि कोई भी ये इलनेस जो अगर आप तीनों जो मैंने गिनाई है कितने दिन तक रह रही है। इची नोज, इची आईज, कि आप बार बार आपको नाक को रगड़ना पड़ रहा है, आंखों को रगड़ना पड़ रहा है। सो एक्चुअली दीज जो सारे सिम्टम्स हैं ये तीनों में से किसी में भी हो सकते हैं, पर थोड़ी सी प्रोबेबिलिटी ऊपर नीचे करके हम कह सकते हैं कि कौन से सिम्टम किस में ज्यादा है किस में नहीं है। जैसे रनी नोज की अब हम बात करते हैं, एक्सेसिव स्नीजिंग की बात करते हैं, तो ये ज्यादातर आपको फ्लू में मिलेगा। सोर थ्रोट, क्रोकी वॉइस, पेन इन द थ्रोट, डिफिकल्टी इन swallowing, खाने में कुछ प्रॉब्लम, अंदर निगलने में कुछ नहीं जा रहा, अंदर पेन हो रहा है यहाँ पे, वो ज्यादातर आपका कोविड में ज्यादा कॉमन है। स्पार्किंग हाई टेम्परेचर, वो कोविड में ज्यादा कॉमन है। लॉस ऑफ टेस्ट, कि मुंह में जो आप खा रहे हो उसका कुछ स्वाद ही नहीं आ रहा है, वो कोविड में ज्यादा कॉमन है। नोज की आंख की जो इचीनेस है, बार बार रगड़ना आ जाए, वो एलर्जी में कॉमन ज्यादा है। पर लकली अभी जो मेलबर्न का एलर्जी सीजन नहीं है, जनरली ठंड में जो आपके पोलन काउंट जो वगैरह होती है बहुत कम होती है, तो इसलिए एलर्जी सीजन नहीं है, तो इसलिए वी विल नॉट टॉक मच अबाउट द एलर्जी, विल टॉक मोर अबाउट द फ्लू। तो आई वुड से दो जो कि थोड़े थोड़े इंडिकेशन है कि किस कौन आपको ज्यादा शो करता है कि आपको फ्लू ज्यादा चांसेस है या कोविड ज्यादा चांसेस है, बट स्टिल दीज सिम्टम्स आर वेरी वेरी ओवरलैपिंग। और अभी जो नया स्ट्रेन निकला है B4 B5, उसमें जो नॉर्मल फ्लू के जो सिम्टम्स होते हैं रनी नोज वाले, वो ज्यादा दिख रहे हैं। सो बेसिकली द पिक्चर ओवरऑल आप ये कह सकते हैं कि बिकम वेरी ब्लर्ड ना। जो पहले पिछले साल तक हम कहते थे कि अगर आपको ब्लॉक नोज है, सोर थ्रोट है, हाई पीकिंग टेम्परेचर है, तो आपके कोविड की चांसेस ज्यादा हैं। अगर आपको स्नीजिंग ज्यादा है, स्नीजिंग ज्यादा आ रही है, तो माइल्ड टेम्परेचर जा रहा है, तो आपके फ्लू के चांसेस ज्यादा है। तो नाउ विद अ न्यू वेरिएंट एंड इट इज getting quite overlap. So basically the message which I want to give to the community is that कि अगर आपको sore throat हो रहा है, sneezing हो रही है, block nose हो रहा है, टेम्परेचर आ रहा है किसी भी अनएक्सप्लेन रीजन की वजह से, तो बेटर टू गेट योरसेल्फ टेस्टेड। अगर आपके पास रैट टेस्ट है घर पे तो रैट टेस्ट करें, एंड नहीं है तो PCR टेस्ट करवाएं। रैट टेस्ट के अंदर मतलब जो रिसेंटली जो वी हैव लर्न ओवर द टाइम इन लास्ट 6-12 महीने में जब से रैट टेस्ट मार्केट में आया है, कि अगर पॉजिटिव है रेड टेस्ट उसकी ज़्यादा वैल्यू है rather than नेगेटिव. अगर आपको सिम्टम है, रेड टेस्ट पॉजिटिव है, तो कंसीडर कि आपको कोविड है. अगर आपको सिम्टम है, रेड टेस्ट नेगेटिव है, so it does not mean you don't have COVID. Then better कि आप उसका PCR टेस्ट जो स्टैंडर्ड टेस्ट शुरू से 2020 से जो शुरू हुआ था उसको आप कराएं, and there is a high possibility that that will be positive. So nearly 60% से ज़्यादा अभी हम देख रहे हैं कि 60 से ज़्यादा पॉजिटिविटी रेट नहीं है रैट टेस्ट की. तो 40% केसेस में वो नेगेटिव जो है वो it does not mean it's a real negative.
If you have the symptoms, go and do the PCR test in spite of the rat kit showing a negative test.
Absolutely. This is a message I want
Yeah.
to give it to the community.
Thank you. How do we best protect our children during this time, and especially younger children?
Yep. I think, देखिए जैसे कि when we know we have a vaccination for children up to certain age, like,
Yes.
Moderna vaccinations over 6 years and Pfizer up from 5 year onward. So there is a protection from these vaccinations. So best way at this stage कि जबकि बच्चों में कोविड जो है उतना सीवियर नहीं है, उनके हॉस्पिटल जाने के चांसेस कम है, but still it is very necessary to protect them, because I will feel bad even a one child end up in hospital and needing in a ICU care, or if we lose one child, one life. And that has got worse implication on the whole family, and the child who can grow up and communicate can contribute to the community for so many years, and that thing is lost. So वो हम लोग प्रोटेक्ट कर सकते हैं. पहली चीज तो वैक्सीनेशन से उस एज में जो कि हम सजेस्ट करते हैं कि फाइजर वैक्सीनेशन 5 से 11 साल के ऊपर वालों में, मॉडर्ना 6 से ऊपर वालों में. अभी 5 से नीचे में वैक्सीनेशन has not been approved. Studies are going on, and I'm pretty sure आप लोगों ने पढ़ा होगा न्यूज में कि 6 महीने के बच्चों के ऊपर safety profile has come up, and hopefully down the track in few months time that vaccination will also commence. तो पहली चीज तो है वैक्सीनेशन फॉर द चिल्ड्रन. जो छोटे बच्चे हैं जिनमें वैक्सीनेशन अभी नहीं है, उनको हम प्रोटेक्ट कर सकते हैं मेकिंग ए रिंग ऑफ प्रोटेक्शन अराउंड दैट. तो जो भी उस घर में अडल्ट रह रहे हैं, बड़े बच्चे रह रहे हैं, उनको आप वैक्सीनेट करवाएं, जिससे कि बाकी का ट्रांसमिशन रिलेटिवली कम हो. बाकी ओवर द टाइम जो 2 साल से हमने स्टैंडर्ड प्रोसीजर से सीखा है, एंड द इफेक्टिव वे इज फेस मास्क, general health measure, wearing the face mask for children. Generally, I recommend any child more than 2 years of age can effectively wear face mask, of course with a parental supervision, and 5 साल के ऊपर तो is very safely. तो face mask protect for transmission of infection अगर प्रॉपरली आपने पहना हो. Secondly, आपकी सेम वही social distancing, hand sanitizer, and keeping the personal hygiene level, and that is, I think, the best way we can protect them. And vaccination for the whole family is important. And I mean, luckily we are living in a country where the COVID vaccination rate of first 2 doses is very high, nearly 95%. Very few countries in the world we have. But when we are going to the booster doses, unfortunately, that we have not reached to that level yet. So booster,
It is something I never understand, Raj. Both you and I come from a country where from the time we are born, we are given vaccinations, BCG, booster shot. Why don't we take vaccination? I'm going in for my 4th shot, because if you're over 30, you can, and yet we don't want.
look, I think there is a various reasons. So we have discussed in 2020, 2021, खास करके पिछले साल 2021 में जब वैक्सीनेशन निकला, so about the vaccine hesitancy, and to break that hesitancy and myths which has been created, sometime purposely, sometime because of the lack of knowledge and poor communication among community, and the language gap, different cultural sensitivity, various reasons why we are not taking this vaccination. And like people have put it in there, or because it's a RNA vaccination, it can change your genetic material. People have put it in there. It has not been well researched. Efficacy has not been well researched. The long-term side effect has not been well researched, and certain lot of conspiracy theory. There's a lot of factor which definitely a different Pandora box we can open and discuss about these reasons. And but this is a bit of an unfortunate part when we come to the effective vaccinations where we can save so many lives. We know, I mean, from the last nearly 1 year from America experience and more than 6 months, more than 8, 9 months of Australian experience, that vaccination is effective in reducing the severity of the disease. It's effective in reducing the hospitalization. It's effective in reducing the mortality, the death rate.
And it saves lives.
It saves life. It may not be effective that well in transmitting the infection from one person to another one, and but it is saving so many lives, and particularly those who are in aged care or particularly at risk, where the severity of the disease can be too much and
Yeah.
can be life threatening, and these lives can be saved. And we have seen so many lives in 2020 from the aged care we have lost when the hotel quarantine breakdown happened. So I think vaccination we all need to consider, but of course there there is certain factors and the barrier which we need to break, and of course its responsibility comes from the all sector, from as a community leader you and doing a good job of spreading the knowledge to the community. So many more people need to come up in this line to spread that knowledge. More health professionals like us need to come up who can speak the basic अपनी लैंग्वेज में, अपनी भाषा में लोगों को तक पहुंचा सके. When the message come their own like native language from their own community doctor, I think it become more effective, and it spread the message direct to understanding the cultural sensitivity and the language sensitivity. So we can understand the reason behind their hesitancy much better, and that can we've been very successful last year in breaking this barrier, particularly in our multicultural community, in breaking the barrier of hesitancy.
So yeah, I also wanted to let the listeners know we keep, on the in the news, on TV, we keep hearing that the hospitals are absolutely bursting at the seams. Ambulances are taking time to come. So I think the only way to protect our family, especially when we have young children, is to get vaccinated ourselves and also vaccinate our children wherever possible. So if they are more than 6 years old, they're all eligible for vaccination. Um, do Okay, I'm going to ask about nutrition during COVID times for children.
I think it's a very very important question you ask, because this is the part which is generally get very easily neglected by the child and by the parents too, and particularly more in a our cultural context में, क्योंकि हमारी आदत है इंडियन माओ की बच्चे को बैठ के हाथ से खिलाना, एक एक रोटी का टुकड़ा तोड़ के एक एक चीजों को खिलाना. एंड दैट्स वेयर द प्रॉब्लम कम्स, एंड व्हेन दे सी द चाइल्ड इज हैविंग ऊपर नीचे टेम्परेचर हो रहा है, बिल्कुल बिस्तर पे बेहाल पड़ा हुआ है, टायर्ड है, नहीं मम्मी मुझे नहीं खाना, एंड दैट्स वेयर द प्रॉब्लम कम हैपन, एंड दैट डेफिनेटली डिलेज द रिकवरी. तो ऐसे टाइम पे मेरी रिकमेंडेशन ये रहती है कि डोंट फोर्स द चाइल्ड टू हैव ए बिग मील्स. लाइक नॉर्मल जो अपना होता है कि सुबह सुबह ब्रेकफास्ट में खास करके मेरी माँ जैसे सवेरे सवेरे उठ के पंजाबी पराठे मक्खन नाल दिंदी सी. सो सो दैट यू डोंट नीड टू गिव कि ਤੁਹਾਨੂੰ जो है पराठे खाने बच्चे ਨੂੰ या दोपहर ਨੂੰ चार रोटियां खानी है, रात में चार रोटियां खानी है. So that's not necessary. That can be reduced multiple small meals. रोटी, एक रोटी खा ली या ब्रेड खा लिया, थोड़ी देर में एक एप्पल खा लिया, थोड़ी देर में एक अंडा खा लिया, उसके 1 घंटे के बाद आपने कुछ लिक्विड बना के दे दिया, स्मूदी बना के दे दी, थोड़ी सी आइसक्रीम दे दी. सो डिफरेंट मल्टीपल मील आर द इम्पोर्टेंट थिंग rather than the big large meal. क्योंकि 2-3 रीजन साथ में देखिए. एक तो बच्चों का टेम्परेचर हो रहा है, दूसरी चीज हो रही है, आप देखिए कि सोर थ्रोट इतना ज्यादा है, उसके बाद बल्कि स्पाइसी फूड वैसे भी नहीं निकला जाएगा. So something soothing food, something between liquidy food, something which is a bit of a cold food can be given. Cold means ना कि आप दाल को ठंडी करके दो. कोल्ड मतलब लाके खास करके इसके लिए मैं जान करके ये बोला क्योंकि हमारा बड़ा ही एक मिथ है कि बच्चे को टेम्परेचर है तो उसको आइसक्रीम से दूर रखो, उसको
Yes, I was going to ask you that.
you know,
Yes.
कि उसको ठंडा दही नहीं दो, उसको केला नहीं दो, वो ठंडा हो जाता है. ये जो ठंडा गर्म की जो खाने की चीजें हैं, ये एक कंसेप्ट जब तक मैं बच्चा था माँ बताती थी तब तक मेरे को समझ में आता था. अनफॉर्चुनेटली जब से मैं डॉक्टर बना हूँ ये कंसेप्ट तब से मेरे समझ में नहीं आया क्योंकि इसके पीछे आई कुडंट फाइंड एनी लॉजिकल रिसर्च बेस्ड रीजन that which food is hot and cold. So what I generally recommend, you can give ice cream during when the child is having temperature. You can give a milk to the child when the child is sick. You can give yogurt to the child when child is sick. आप उसको दही चावल दे सकते हैं, दूध चावल दे सकते हैं चीनी मिला करके जो आप पुराने में देते हैं. तो इसके लिए आपको कोई रोक नहीं है इन चीजों के लिए अगर चाहे बच्चे को वो खाना पसंद लगता है. क्योंकि अगर सोर थ्रोट होता है एनीथिंग विच इज कोल्ड विल बी एक चाइल्ड कैन swallow इट वेरी इजीली. तो ये छोटे छोटे खाने दें. सेम चीज आपकी जब लिक्विड कहते हैं कि हम बोलते हैं कि बच्चे को हाइड्रेट रखना जरूरी है कि वो रिमेन हाइड्रेटेड, शुड नॉट बी डिहाइड्रेटेड. से मल्टी पूरा ग्लास पानी पीने की जरूरत नहीं है, मल्टीपल सिप्स बीच बीच में लेते रहे. स्ट्रॉ डाल दें ग्लास में, स्ट्रॉ से वो अपना दो दो सिप बीच में खींचा रहे. तो दैट कैन गो इजीली rather than taking a big सोलो करना उसके लिए पेनफुल हो सकता है. तो स्ट्रॉ से धीरे धीरे खींचता रहे, दैट वुड बी गुड. So keeping your child well hydrated and keeping your child giving a multiple meal, multiple small meal rather than a large meal, always good.
Thank you. I have a few ladies who have joined. Gitanjali, thank you for watching. Gitanjali is a community leader in the western suburbs, Raj. I have I have
Welcome,
recently met
Gitanjali.
her. Hello, Pooja. Thank you for watching. I hope all this is very helpful to you and all your groups, Gitanjali. Um, do children have long COVID, Raj?
Another very intelligent question, I must say.
Before
Long
we
co-
start, I want to show you what Gitanjali has just said about you.
Thank you, Gitanjali. Thanks a lot. So long COVID. Let's talk in this way first. I say कि what is long COVID? क्योंकि एक्चुअली लोगों के बीच में एक बहुत कंफ्यूजन है. लॉन्ग कोविड का मतलब है कि ऑलमोस्ट द सेम सिम्टम्स ऑफ कोविड, ठीक है, जो परसिस्ट करें 4 हफ्ते से ज्यादा. एक आर्बिट्रेरी डेफिनेशन है ये, कोई बहुत हार्ड एंड फास्ट रूल नहीं है. देयर इज नो एब्सोल्यूट डेफिनेशन इज नोन येट, बट जनरली हम लोग करते हैं कि अगर 4 हफ्ते से ज्यादा सिम्टम परसिस्ट कर रहे हैं तो दैट वी से इट इज ए लॉन्ग कोविड. अब कौन कौन से सिम्टम्स हैं जो कि परसिस्ट करते हैं? जो कॉमनली होते हैं कि फीलिंग वेरी टायर्ड, एग्जॉस्टेड, लैक ऑफ एनर्जी, काम करने को मन नहीं कर रहा, काम पे जा रहे हैं उस पर आप कंसंट्रेट नहीं कर रहे हैं, आपको लग रहा है कि आपकी ओवरऑल मेमोरी पहले से कम हो गई है, आपको लग रहा है कि मैं जितनी फुर्ती से पहले अपने कोई भी डिसीजन ले लेता था वो डिसीजन नहीं ले पाता हूं, कोई भी 2-3 क्वेश्चन आते हैं, डिसीजन मेकिंग प्रॉब्लम सॉल्विंग की चीज आती है तो माय ब्रेन गेट क्लॉग्ड अप. तो वो आपकी जो नॉर्मल डिसीजन मेकिंग की पावर है वो कम हो गई है. हेडेक परसिस्ट कर रहा है, बीच बीच में आ रहा है जा रहा है, आप चाहते आपको लगता है कि मैं हमेशा मेरे को सोते ही रहना ज्यादा अच्छा लगता है. तो ये वाले जो सिम्टम्स हैं, इफ इट कीप परसिस्टिंग फॉर मोर देन 4 weeks, वी से दैट इज लॉन्ग कोविड. Adult may actually it is much more common than children. The,
Yes.
the short answer to your question is, does long COVID happen in children? Yes, it does happen. It can happen in any age again, but luckily क्योंकि symptoms overall बच्चों में बहुत कम होते हैं, कम सीवियर होते हैं, जैसे मैंने आपके पहले क्वेश्चन में बात हुई थी, तो ओवरऑल लॉन्ग कोविड होने के चांसेस भी बच्चों में कम है. ऑन एन एवरेज जो ऑस्ट्रेलिया में अभी तक 2 स्टडी हुई है, एक न्यू साउथ वेल्स में, एक विक्टोरिया में, एंड ओवरऑल अमेरिका से काफी स्टडी हुई है लॉन्ग कोविड के बारे में, तो समवेयर बिटवीन 4 to 6% जिनको इन्फेक्शन हुआ है उनको लॉन्ग कोविड हुआ है। तो लॉन्ग कोविड के लिए हम लोग, कोई ऐसा नहीं है कि इन बच्चों को ज्यादा लॉन्ग कोविड होने के चांसेस है एज कंपेयर टू लेस लॉन्ग कोविड होने के चांसेस। बट व्हाट आई हैव सीन इन माय ओन प्राइवेट प्रैक्टिस in the western suburb where I see people from multicultural community, कि long COVID symptoms were more common in children, particularly anxiety, those who are already having pre-existing some problems. So like a child who was already struggling in school because of some reason, now his struggle has become worse. Who was already having some sort of anxiety which is affecting the different aspect of life, now the child has developed anxiety to going back to school because he's feeling tired and exhausted. A child who was already struggling academically in school because of some reason, now he is struggling much more, feel like that I don't have that concentration left with me. Child who already used to have a headache for some reason, by the end of the day, because of the tired exhaustingness or developing migraine, they are more likely to have, they develop headache. So this is sort of a more, you can say, my retrospective anecdotal, मेरी अपना पर्सपेक्टिव जो मैंने देखा मेरी अपनी प्राइवेट प्रैक्टिस में, कि जिस बच्चे को मैं पिछले 4 साल से या 3 साल से 2 साल से पहले से देख रहा हूं, तो या जो पहली बार मेरे पास आए लॉन्ग कोविड करके मेरी क्लिनिक में, though I don't have run my special long COVID clinic, but I found actually their symptoms were more because of the underlying other multiple
Conditions.
issues,
Yep.
and they were not having a good routine of their life anyway. They were not physically active in their life anyway. So that's where the long COVID problem was more common. But yes, it can happen in children. But generally, what we say, majority of the time, it improves with time. Like, अगर हम देखें कि most of the studies have shown, say, long COVID rate is 11 to 15% at 30 days after the COVID diagnosis. And after the 3 months, the diagnosis, it reduced down to 5% or 4%. So with time, it improves. So generally, we suggest in these children, don't ignore it, particularly for the parents. अगर कि आपका बच्चा ये कहता है कि उनको सिम्टम्स हो रहे हैं, परसिस्ट कर रहे हैं, इसके कोविड के रिकवरी के बाद आपका बच्चा स्कूल जाने के लिए मना कर रहा है, ऑलरेडी फीलिंग वेरी एग्जॉस्टिंग, टायर्ड, एंड उसकी स्लीपिंग पैटर्न अप एंड डाउन है, उसका खाना पीना अप एंड डाउन है, कि कोई उसका टाइम लिमिट नहीं है, दिस इज द टाइम, don't ignore it. Start acting on few things which you can actually do yourself alone, and before you are waiting to see a pediatrician, because definitely you need to see a pediatrician to rule out few other things which can happen and may coexist with COVID, or maybe apparently it is something else, but we are COVID has made it worse or made it unmasked and brought to the surface. तो कुछ चीजें जो आप कर सकते हैं, कि जो एक तो ये है कि ट्राई टू ब्रिंग ए रूटीन टू द चाइल्ड्स लाइफ, कि ये नहीं कि रात को कभी 12 बजे सो रहा है, कभी 2 बजे सो रहा है, कभी 4 बजे सो रहा है, कभी 10 बजे सो रहा है. ट्राई टू ब्रिंग सम कंसिस्टेंसी इन द लाइफ, सो मेक ए गुड स्लीपिंग पैटर्न. सो क्योंकि अगर बच्चा दिन में सोता रहेगा 8 घंटे 4 घंटे, तो ऑब्वियस है कि रात को नहीं सोएगा. सो ब्रिंग द रूटीन इन लाइफ, नंबर 1. नंबर 2, same thing, bring the routine of eating good healthy food and a regular interval, not like a skipping breakfast, skipping lunch, क्योंकि अगर आप 12 बजे उठ रहे हो तो you're skipping your breakfast. So have a breakfast on time, get the life back on track. That's a very important thing. Talk to the school teacher how to integrate, or the school a special services coordinator or well-being coordinator, how to integrate the child back to the school. May not be in a full capacity, maybe limited capacity. Like maybe you can say child cannot tolerate the degree of tiredness in school for full day from 8:30 to 3:30. You can say, all right, I'll send my child to school maybe 1 hour every day first week. Next week 2 hours every day, thanks 3 hours, 4 hours, and then based on child capacity keep increasing that duration in school. Try to involve child with a limited physical activity, graded activity. Just take the child out for a walk and see how the child is feeling. Maybe 1K walk around the house, in a garden close by, on a park close by. So then this will give an incentive to the child. Child will not go alone. So you can't say a 10-year-old child, why you're being lazy and sleeping, and you go and do something. But you need to get, not you do, you say, let us go for a walk. So be the leader, take the child for a walk rather than blaming the child, you being lying at home, not doing anything. You can say, child, come with me, let's go for a walk. So that would be a better way to integrate the child back to the normal routine life and school. And while we are waiting to see a pediatrician, I know at this stage some parent definitely complain to me, Raj, it's so hard to see you because you've got such a long waiting time to see. So when you're waiting to see pediatrician, at least you can start doing these things at home, and maybe you can avoid seeing a pediatrician.
Thank you.
Thank you.
We have some awesome comments coming in, Raj. I have to share this with you from Gitanjali. Much required session, especially moms like me juggling around things with baby. Um, Thank you for watching, Samin. Samin runs Radio Bowl from where I broadcast. She's really good. Um, Thank you for watching, Shivani. And Tajinder Kaur also likes the session. So there we go. Thank you. Thank you. Thank you. Thank you, Raj.
Thank you,
Um,
everyone.
Thank you, ladies, for watching. And I cannot ever thank Raj enough for all that he does free of charge on Chai Chat community every month. Uh, there you go. Poonam Arora has a message for you.
Thank you, Punam.
Um, I want to ask something because I take public transport and I see, older people like me who go into work, which of course, like I told you, we've been asked to work from home from next week. The younger people do not wear masks. The people on trains who are not wearing masks are basically young people. Um, So, if young people are not understanding the importance of mask wearing, how do you explain to children who are 8, 7? Initially they used to say, the government said anyone under 12 doesn't need to wear masks, but that has changed now because the new variant is so fast moving. Both you and I know about it. So, how do you tell a 6-year-old or a 7-year-old wear a mask? And especially when they are sitting in a classroom full of their friends, they want to go and play. Do they take off their mask in the playground? What can parents do? What can parents say to them? How can they make it easy?
Look, I think we all know the importance of face mask. There is no doubt about that. That's what we have learned in last 2 years from pandemic, and it works. And it works in various way, protecting yourself getting infected, and if you have infection, and you protect the community spreading from you to the rest of the community. Actually, to be honest, जो मैंने अपनी क्लिनिक में सीखा है कि बच्चे जो पिछले 2 साल में जो बच्चों ने देखा है, they are more adaptive to mask, they are more receptive to mask. The problem most of the time comes from us adult, and that always I say to the parents, look, adult children are our mirror image. जो आप शीशे में दिखाते हो उनको, वो वही देखेंगे. अगर एज ए एडल्ट मैं अपने घर में हेजिटेट करूंगा मास्क के लिए, मैं टेबल पे बैठ के, डाइनिंग टेबल पे बैठ के मास्क के अगेंस्ट डिस्कशन करूंगा, तो डेफिनेटली दैट्स गोइंग टू इम्प्रिंट इन माय चाइल्ड्स ब्रेन द नेगेटिविटी ओवर देयर. So first thing is, I would say, the direct answer to your question, ki don't talk in front of your child negative about the mask. Second thing is anxiety about the mask. कि Children are very, very clever. They read your facial expression much more than us when you are sad, when you're anxious, when you're nervous. So if you show your anxiety about the mask, oh, when I put the mask, I feel so suffocated. I just can't stand it. I feel anxious. I feel breathing difficulty. I can't breathe when I put the mask on. Again, the child is going to read the same body language from you and will show the same symptoms. I'm getting anxious. I'm getting nervous. I can't breathe, and that's making we are making the child a child's life difficult in that way. And if we talk more positive about the mask, if we talk more positive about ourselves, and you show the child कि देखो बच्चे, मम्मी ने ऐसे मास्क लगाया है, ऐसे मास्क लगाते हैं, ऐसे यहाँ पे रखते हैं, then definitely child is going to accept it. So what we need to do, if we want our child, what we want our child to do, we need to do first on ourselves, and then child will accept it. छोटे बच्चे और जो छोटे वाले हैं, इनफैक्ट अब कुछ दिन पहले मैंने अपने फेसबुक पे एक मेरी क्लिनिक में आया था 3 साल का बच्चा, मास्क लगाया हुआ, तो मैंने उसे डाला कि कमेंट डाल साथ में लिखा था कि डू वी हैव एनी एक्सक्यूज not to wear a mask when a 3-year child with autism can wear this mask and sitting in my clinic. I took parents' permissions to take that photo and say, this will be very good for me to educate community. So when a 3-year-old can put the mask, and which is a child with autism, if you have idea, then how difficult it is for them to put the mask on because of their own so many other sensory issues underlying. तो हमारे पास कोई एक्सक्यूज नहीं है. तो छोटे बच्चे हैं, उनको खिलौनों के ऊपर, उनकी डॉल के ऊपर, मास्क के ऊपर करना, this is another way we can show them how to put the mask. Involving the child in the mask care daily. जब मास्क अगर आपके डिस्पोजेबल नहीं कपड़े वाले यूज कर रहे हैं, तो टेक द चाइल्ड हाउ टू वॉश इट, हाउ टू कीप इट, डेली केयर में जब आप इन्वॉल्व करते हैं बच्चे को, हर चीज का इंटरेस्ट आता है. So that's what I would strongly recommend to put. And that definitely increase the positivity amongst the child and more acceptance among the child to the mask. Simple daily rules are more effective with me rather than enforcement is needed.
Sure. Thank you. So, when would you ask a child not to wear a mask? What happens if the child has asthma? Do they still wear a mask, or?
Look, I think asthma is not a contraindication for wearing mask, because particularly when asthma is well controlled and child is on preventer, taking preventer, asthma is well controlled. If a child can go to sports, normal routine activity, that means the asthma is well controlled.
Thank you. Yeah.
Indirect way of understanding, मोटे मोटे तौर पे जिसको हम बोलते हैं, अगर बच्चा आपके साथ बैठ करके पूरा कन्वर्सेशन लंबी 5-6 वर्ड्स के सेंटेंस बोल सकता है, इसका मतलब चाइल्ड इज नॉट एन एक्यूट एस्मा अटैक. तो इसके लिए इसका मतलब कि उसका एस्मा इज नॉट गोइंग टू वर्स. यस, कुछ बच्चे जो कि रिकवरी स्टेज में हैं, जैसे एस्मा का अटैक हुआ, भी रिकवर हो रहे हैं, या कुछ बच्चों को एक हाइपर वेंटिलेशन होना शुरू हो जाता है बिकॉज ऑफ अगेन एंजाइटी की वजह से, उनको बीच बीच में ब्रेक लेने के लिए कोई प्रॉब्लम नहीं है. They can take the break from the mask in between. अभी उसमें कैसे आप मास्क में ले सकते हैं, जैसे आप अपनी मान लीजिए क्लास में बैठे हुए हैं, तो 2 पीरियड के बीच का टाइम है, यू कैन टेक 5 minutes break. If you are feeling uncomfortable, you can ask the teacher, go out of the class and take 5 minutes, 10-minute break and come back in. If you're feeling suffocated and you're feeling your nose is getting blocked because of the moisture, humidity की वजह से हो रहा है, तो वो आप बीच बीच में ब्रेक ले सकते हैं. जब आप खुली जगह में चले जाएं, अपने निकाल कर जाके, एंड जहाँ पे आप अकेले हो, टेक द ब्रेथ, फ्रेश एयर, पुट द मास्क बैक एंड कम बैक अगेन. सो ऐसी जगह पे you can take the mask on. Of course, off while you're eating, you can take the mask off during this time.
Thank you. Last question, then the most important one.
जी.
So we know children have phobias about injections, needles. What can we do as parents? I would never ever take my girls for any shot. We were living in Delhi, and my maid, my housekeeper, she would take the girls. I would sit in the car or sit outside in the doctor's office, but I would not go inside. I still can't do it. So if I
Okay.
can't do it,
तो
these
मैं
phobias,
आपके आपके क्वेश्चन का आंसर आप ही से पूछता हूं, आप क्यों नहीं जाती? Tell me,
I, I,
why did
I
you
hate
not go?
it. I hate injections. I hate it. Even now for myself, I don't. I mean, every time um, I'm going, as I told you, I'm going for my fourth shot on Wednesday. I turn my face. I don't want to look. I don't know. It's a fear of the unknown. So if I am
Exact,
so scared,
yeah,
then,
exactly.
what
This
do
is
I
the
tell a child? Thank you for watching, Anand. Anand is one of my colleagues in Indian Care. He's one of the board members. Thank you, Anand.
वेलकम आनंद जी. मिल चुका हूं मैं आनंद जी से पहले.
Okay.
ओके. सो आपके जो क्वेश्चन का जो आंसर है ना, उसका पहला आंसर आप ही हैं. जो मैंने पहले बोला था कि चिल्ड्रन आर वेरी क्लेवर इन टर्म्स ऑफ रीडिंग योर बॉडी लैंग्वेज. अगर आप एज ए मदर अपनी एंजाइटी दिखाएंगी वहां पे, so definitely child is going to be super anxious and nervous and having a bigger phobia for the needle than you. So if you talk negative about the needle injections or COVID vaccination, oh God, I hate needles. I can never take needles. It gives me panic attack. It makes me anxious. मेरे हाथ पांव फूल जाते हैं, nervous हो जाती हूँ, मैं 4 बार collapse हो चुकी हूँ. Do you think your child is going to take that needle? Never it's going to happen. So मेरा पहला मैसेज हमेशा ये है पेरेंट्स के लिए कि अगर आपको अपने बच्चे को नीडल लगवानी है, never talk negative about needle in front of your child. Never show your anxiety to your child. And if you show this anxiety and child will read it, it's going to be double and it's going to be worse for the child. And he's not going to take that needle. तो आप कभी भी निडल के बारे में नेगेटिव मत बोलें. ठीक है जी. पहला क्वेश्चन जो
That
आप
is a message
नेगेटिव.
for Gitanjali, who is saying she is just like me.
तो ये मैसेज कम्युनिटी के एक्चुअली मेजॉरिटी ऑफ मदर्स के लिए है, because this is what the common reason I see in my practice too. If, when you talk about needle or the blood test in a child, the first thing said mom will say it's going to be very difficult for the child, I know, because I'm also like this. And then I send her, oh, the problem is more with the mother here than with the child. I'm sorry if other mothers are feeling offended, and I have no right to offend anybody. It's my personal experience and observation. I'm just passing on, and which to make the things much better for your life. So I'm not trying to offend anybody. I'm sorry if anybody is feeling bad
No,
about
I
that.
don't think anybody's offended. We understand. I mean, I understand. This is me that you're talking about. I'm so scared I could never take it. And I'm sure there are many like me who are also scared. What about dads doing it?
Look, generally dads are not too bad, to be honest, but there are. There is or you can say rate is much more in moms as compared to dads, and it's in general also. In general, generalized anxiety rate is much more common in women as compared to male. So, and that's down the track is reflected down in the next generation in the same way. And needle phobia is very high. It's nearly 65%. Can you
Wow.
believe it? It's such high incidence of needle phobia is. And it is more in, to be unfortunately more in our community, because the problem in our community, particularly the multicultural community I'm talking about, we do give needle back in our home, if you see, by force, holding the child, grabbing the child, pinning it in down, and कोई बात नहीं डॉक्टर साहब इन्हें तो रोना हैगा ही है, कोई गल नहीं इत्थे दे दियो तुसी. And then the next time it's going to be, this is the second answer to your question. This is, never do that degree of forceful things with the child. Explain the child first that what's going to happen and how it's going to happen. Don't say that oh, I will not tell the child before the needle. I'll take in and just I will hold the child, grab the child, let the child cry, and give the needle. This is for less than 1 year. Yes, you can't explain, but उसके ऊपर वाली उम्र में जितना भी possible हो सकता है, try to explain the child what is going to happen, what is expected from the needle. Don't talk too much negative about the needle. Don't talk too much positive about the needle also. Don't say, oh, this doesn't hurt at all. It's not going to cause you any pain. This is going to be a good experience. And you pinch on the in the child. Oh, it was going to be like this little pinch. And don't talk these sort of a too much negative and positive both way. Give the realistic picture to the child that this is going to a little bit hurt you, but it's very temporary, and it's not going to cause any trouble. But this needle is going to help you many ways. Talk the positive things about the needle, how it's going to help you. It's going to make you safe. You will not end up in the hospital. It's going may save your life, and it will protect all of our family. And we are all having, your brother is having, your sister is having, your dad is having, everybody is having. Give this positive image that everyone is having, and then chances of that child being successful is having needle is very high. Next thing we talk about, tell the if your child is having needle phobia, if you're going to the clinic, tell the clinic nurse in advance that my child is having a very, severe anxiety or needle phobia, and so that the nurse is well prepared for that. So certain things like needle, all the material, drawing, everything, they can keep the things ready before your child walk in. So you're having a minimum time spent in the clinic. But child is already well prepared before. So whatever the history needs to be taken nowadays, like a telehealth is allowed, so nurse can take on telephone. So vaccination, indication, contraindications, all that things, history can be medical history can be taken on telephone. So and by the time you come to the needle, just go to the room, 1 or 2 minute visit, everything already sorted out, drawn up, kept over there, and explain the child, get the needle. It's a minimum experience. The child is not getting petrified of all the experiences, seeing other child crying over there. Never bring your sibling with you to the needle who already have needle phobia, because that is going to spread more negativity there. So, and if there are few children still we are not successful, we are particularly children with autism जो हमने पहले भी बात करी थी, उनमें needle लगाना, blood test करना, COVID vaccination देना is a challenge. And उनके लिए हम लोग स्पेशल डे केयर यूनिट में, रॉयल चिल्ड्रन हॉस्पिटल में एडमिशन करके करते हैं, या तो जैसे डिफरेंट डिस्ट्रैक्शन टेक्निक यूज करी जाती है, कभी बबल बनाया, टीवी लगाया, बात कर रहे हैं, we'll keep talking to them to distract them and it works majority of the time. and then नहीं है तो फिर आपकी लाफिंग गैस एनेस्थीसिया दे करके, या ऊपर ये जिनको बोलते हैं एंजेला क्रीम आप लगाते हैं, and that works very well. But these percentage is very very low. I mean less than 1% भी नहीं है, 1% भी नहीं है वो.
Thank you. Before we end tonight, Raj, do you want to say anything else other than everybody please get vaccinated?
So मैं तो यही कहूँगा कि look, COVID vaccination, the COVID infection rate is getting higher and high. So important thing is to protect yourself. Hopefully this time it's not going to be lockdown. And at one stage of time, almost everyone in the community is going to be infected. And the biggest brunt is being faced by us, by the medical professional. Like as जैसे मैंने सुबह बोला कि मैं वार्ड में राउंड लेने के लिए गया तो there is hardly any bed available. We are all chock blocked. And majority of them या तो फ्लू वायरस है, या RSV वायरस है, या कोविड है. तो पूरा वार्ड फुल है उससे. तो अपने आप को प्रोटेक्ट करें as long as you can. If there is a need for medical help, ask help early. इमरजेंसी में अननेसेसरी छोटी छोटी सिम्टम्स में जाकर के उन लोगों के लिए आप ट्रीटमेंट मत डिले करें जिनको की रियल इमरजेंसी है, जिनको की रियली जरूरत है, क्योंकि पीपल आर वेटिंग आउटसाइड इन एम्बुलेंस टू बी looked after inside, and because there's no bed available they can't bring them in. So इस तरीके से आप अपनी अपनी फैमिली की, अपनी कम्युनिटी की हेल्प कर सकते हैं। और ऑफ कोर्स एज ए हमारी हेल्थ प्रोफेशन का लोड थोड़ा कम हो जाएगा इससे। थैंक यू वेरी मच एंड टेक केयर।
And Pooja Arora would like to say a thank you for a very informative session. Thank you for watching, Pooja. Thank you, Raj. We will meet soon. And thank you once again for everything that you do.
थैंक यू
Good night,
सर, थैंक यू
everyone.
वेरी मच, माय
Okay,
प्लेजर।
bye.